day, viewers. You're once again welcome to this program, Sight Ed, a sight educational program designed specifically to enlighten every one of us on eye health issues. I remain your host, Feyi Adepoju. Sight Ed is about preserving vision, restoring sight. Today we're going to be talking about a condition which is prevalent in our communities. We're going to be looking at traditional eye medications and self-medications. What do they stand for? What are the benefits and disadvantages of using traditional eye medications as well as doing self-medication? So today, to look at the issue of traditional eye medications and self-medications are two consultants that have been interviewed on this same subject.
I am Professor Adebokola Adefilo-Shitel, retired professor of surgery and ophthalmology. Actually, the traditional medications dated back to history, but most of them did not have scientific clarifications and backgrounds. But they have been existent. Self-medication is promoted by ignorance and poverty. Most people want to help themselves because, one, they could not afford to pay for the services that are now presently available. And we have one thing that we practice which is not too good. Something is wrong with you because somebody else has used that particular medicine. They now recommend for somebody else to use. It may not be the same problem. So that is where we get a lot of complications coming in, and we are getting some blindness resulting from this.
Traditional eye medicines. Some of these things are made from caustic materials, things that will corrode the eye. Some of them are made from herbal preparations that contain fungus. And if you put it into the eye, it may lead to blindness. One problem of the eye that occurs in epidemic, sometime annually, is what our people call Apollo. That is acute hemorrhagic conjunctivitis caused by a virus. On its own, it can go. It is self-limiting. Within 10 days of onset, it can go. Just be washing your face with clean water, removing any associated discharge, it can go. Taking paracetamol tablets to reduce discomfort. But the trouble is that out of anxiety and panic, people go ahead to put different kinds of medicines in the eye. Some we put cassava water, some put human urine. We personally have encountered some people who using human urine that was infected with gonorrhea and then got the eyes, snuffed off by the infection from the urine. And this is something that on its own shouldn't have caused any problem. Some put cassava water, some put petrol, some put kerosene. These are unnecessary. Again, if you are so much worried when this problem comes, go to any hospital or health center and see a doctor. Do not consult your peers in the beer parlor or in the marketplaces. And one thing is clear. Remember that every drug is a potential poison. And an eye drop given to you for a particular disorder if it cures it, may be dangerous for the other one. Certain drugs do affect the eyes and can lead to permanent blindness. I give you an example. Chloroquine, which is useful in treatment of malaria, if abused, will lead to blindness. We all should realize that alcohol is a form of drug, and if it is abused, will lead to blindness. Last year there was noise, or there was scare in Ondo State about people who, some died, some suddenly got blind. Also in Rivers State, it was because they took a dangerous form of alcohol, methanol. So these are things that get people needlessly blind, and we have to tell our people about that. So go to hospital, see a doctor. Even if the doctor is not an ophthalmologist, an MBBS holder, we examine you and then refer you to the appropriate place. Our people are very religious, but we have to be careful in doing certain things in the name of religion that could also damage our eyes. Some people put holy water into the eyes. That is dangerous. Holy water is hypertonic saline. In other words, water mixed with salt, making it highly concentrated. Being a highly concentrated solution, it will dry up the eye surface and render the person needlessly blind.
And that is how the drug for hypertension work. Before I go on the program tonight, I want to introduce one eye drug to you. This one is called isin. It can cure any type of eye disease. Glaucoma, cataract, red eye, issue of the eye. In fact, if you are using glasses before, once you taste this, you will throw away your glasses. Another name we call it is sharp. Because if you use it, it will make your eye sharp. This is the solution to your eye problem. It's in my hand. Yes, till next week.
I will advise my people not just to, put anything in their eyes, even when they are being advertised, until they are sure that they have been scientifically tested and approved.
All right, viewers, you're welcome back from the interview segment. I'd like to share one or two experiences among several that I've heard in the course of working as an eye doctor. A couple of years back, a woman presented with poor vision both eyes, and she was said to have had red eyes involving the two eyes, most likely a polo. A neighbor of ours advised that she should put battery water, and that was exactly what she did. And she put battery water in the two eyes at the same time. Of course, she lost vision in the two eyes because the corneas were washed off and there was nothing we could do to help her. Well, you may say that was some couple of years back, but I also have another experience about a month or 3 weeks ago when a young man, about 31-year-old, presented to the eye clinic who had bilateral red eyes from maybe viral conjunctivitis, and he was advised to put urine in his eyes. So he put his own urines in the two eyes, and almost immediately he started having copious pus discharge from the two eyes. By the time he was presenting to the hospital, vision was already gone. And further questioning revealed that prior to this time, he had had a milky or pus discharge in his own urine. And then this same urine is what he has applied in the two eyes. And that's how he got gonococcal conjunctivitis and keratitis. And he also lost vision in the two eyes. So this is how serious the issue of traditional eye medications or self-medication can be. Oftentimes, vision lost from this act are often irreversible. So you will understand the import of the topic we have discussed today, and our advice is that you should please avoid the use of traditional eye medications and self-restoring sight. I do hope you join us at the next time. See you.